untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question: what is a nursing diagnosis for Gerd? Answer by Agcaster. There isn't one. No, there isn't. Read on. I assume you are a nursing student. I won't answer this question the way you expect or hope, because nursing interventions are based on nursing diagnoses, not medical diagnoses. This is also why I deeply regret how eager people here are to give a stud and her homework without looking at the larger picture. I feel this way in part because they're wrong. They so often just talk only about implementing parts of the medical plan of care, and in part because they don't get the goal for nursing education. Sure, you have to know about the medical diagnosis and its implications for nursing, because nursing is legally obligated to implement some aspects of the medical plan of care. Other disciplines may implement other parts, like radiology, or therapy, or, that is not to say that everything nursing assesses, is, and does is part of the medical plan of care. It is not. That's where nursing diagnosis comes in. There is no magic list of medical diagnoses from which you can derive nursing diagnoses. There is no one from column A, one from column B list out there. Nursing diagnosis does not derive from medical diagnosis, period. This is one of the most difficult concepts for some nursing students to incorporate into their understanding of what nursing is, which is why I strive to think of multiple ways to say it. There is also no justification for the idea that all nursing diagnosis is related to the patient's response to the medical diagnosis. Heaven help the patient who has the defining characteristics of any nursing diagnoses that have nothing whatsoever to do with the medical diagnosis. Does his nurse just ignore those? Separate and distinct from the medical plan of care, you are responsible for looking at your patient as a person who requires nursing expertise in nursing, a wholly different scientific field with a wholly separate body of knowledge about assessment and diagnosis and treatment in it. That's where nursing assessment and subsequent diagnosis comes in when you're planning the nursing care your patient needs and deserves. You don't choose a nursing diagnosis, you make a nursing diagnosis in the same way a physician makes a medical diagnosis, from assessment and analysis. This is one of the hardest things for students to learn, how to think like a nurse, and not like a physician of bandage. Some people never do develop enough critical thinking skill to move beyond writing a nursing plan of care full of things like assess/monitor, give meds and force as ordered. These are tasks that nurses do, but they are not nursing interventions. These students completely miss the point of nursing its own self. They will fail their licensure examinations. I know it's hard to wrap your head around when so much of what we have to know overlaps the medical diagnostic process and the medical treatment plan. That's why nursing is so critically important to patients. You wouldn't think much of a doc who came into the exam room on your first visit ever and announced, "You've got leukemia. We'll start you on chemo. Now, let's draw some blood." Facts should come first, diagnosis second, plan of care next. This works for medical assessment and diagnosis and plan of care, and for nursing assessment, diagnosis, and plan of care. You cannot say, "This is the patient's medical diagnosis and I need a nursing diagnosis." It doesn't work like that. So, what would be the nursing assessment of the patient you're asking about, or a hypothetical one? What would you expect to see, hear, feel? Do you know how to take your assessment findings and identify what diagnosis as they define? Just as the physician investigates a differential diagnosis by checking the history and objective findings, labs, oxygenation, color, exercise tolerance, and comparing them to known conditions to make a diagnosis, so will you. Yours are in the non-I 2018-2020, current edition. Get its stat and then you can determine a nursing interventions for them.